for the webinar with Dr. Andrew Heyman, Fellowship Director. Metabolic Medical Institute is a medical organization dedicated to promoting health and prevention of diseases by educating health professionals, researchers, and the public. MMI provides educational courses through conferences, workshops, online modules, and fellowships and certification programs. MMI and our expert faculty will host our brand new live Course 6 in Healthcare Enterprise, Legal and Medical Ethics in Integrative Medicine, which will be highlighted today. I'd like to introduce our Fellowship Director, Dr. Andrew Heyman.
All right, thank you everybody for joining us. This webinar is an introduction to the upcoming module on the business and legal aspects of integrative medicine. I think it's a really important topic because it really sets the stage for how do we create a successful practice, and it goes beyond just improving one's clinical skills, but asking the question, how do we become a complete professional, which I think is a much broader skill set in that regard. Some people are very good at promoting themselves and running their practices, and other people really struggle with that, even despite maybe being excellent clinicians. This is something that is often promoted in other training programs, but what we don't really see is a real detailed educational experience that gets into analyzing financial statements, establishing a marketing plan, understanding operational issues, dealing with real legal challenges that reflect the landscape of our particular style of practice. All of the elements of really what makes a successful professional, and I use that term purposely, professional, because this is not about being a practitioner. It's about someone who has a full identity in the marketplace that goes beyond knowing which therapies to choose. So we'll be covering sort of the basics in that regard, and hopefully reorienting your perspective away from clinical acumen and really focusing on business acumen, which is a different concept. So what are the objectives today? We'll cover a little bit of the industry overview, and that includes some historical components as well as where we in the moment with regard to the consumer aspect of this industry, but also where do I think we're going in the future. Also, what are the 5 keys to practice management success? Some of them are really clinically oriented, which you get from other weekend modules, and some are very specific to sort of the business acumen side. I'll talk a little bit about emerging business models, and I think the pluses and minuses. I would imagine many of you fall into one or two of these categories, and then the rest of the weekend itself will really focus on, clinic structure, office setup, mission and vision, strategic plan, financial statements, marketing strategies. We'll really get into the details in a way that I think is exciting, it's useful, and in fact, we'll be inviting learners to come in. We want you to bring your financial statements. We want you to bring examples of your marketing material. You can have that. So anything that we think really reflects what's actually going on in your practices from a nuts and bolts perspective outside of the clinical piece will help you understand how to look at your financial statements, your P&L, your balance sheet, extract ratios, make better decisions on proper use of free rooms, for example, using certain mathematics or algorithms to understand which service would be more lucrative than another, for example. So from my perspective, someone who is a complete professional in this field understands the dimension of sort of what is the context in which we operate. And there are sort of topical contexts, there are historical contexts, there are sociologic contexts that all sort of shape what this field is about. And I'd like to start with a couple definitions because these are sort of out there in the marketplace that people operate under. Oftentimes, we're seeing practitioners now combine several of these labels sort of under one self-described identity or brandedness. And they have some relevance in terms of how the public might understand implicitly what you do in your practice. So I think choosing these labels are really important. And, there are pluses and minuses probably to all of them to some degree. Some are a bit older, and some are certainly new and contemporary. So complementary medicine, this is a British term. It's been around for several decades now. it was meant to describe any therapy that was sort of supportive of conventional medicine. But it was also meant to indicate those sorts of therapies that were kind of, by definition, diminished in the face of conventional medicine. And that is to say, almost like the garnish on the plate. It's okay if you do homeopathy. It's okay if you do herbs. But don't put it in the middle of the plate. Push it to the side, in a sense. Use it as a supportive strategy for your particular patients. Alternative medicine is more uniquely an American term. And it grew out of this notion of what's unconventional, what's non-traditional, and more specifically, what's not taught in conventional medical school. So it's sort of everything else that wasn't put under the purview of a conventionally trained physician. And usually, and certainly for many, many years, these two terms were combined and certainly offered in a very formal way. So, for example, at NIH, the Office of Alternative Medicine that was established in the early 1990s, I think it was 1993, ran under the label of Office of Alternative Medicine. And then several years later, Congress appropriated more funds and expanded to become the National Center for Complementary and Alternative Medicine. When I ran my research center at the University of Michigan, we received funds from that National Center. In 1998, we ran several large clinical trials. We were funded to conduct educational programming within the medical school. We, at that time, ran under the terminology of complementary and alternative medicine. Not yet had the set of professionals who had finally migrated into academia in particular adopted this term that comes up next, which is integrative medicine. That's one that really was coined in the early 2000s by Andy Weil and his group, formally adopted by a consortium of academic centers that had started out as sort of CAM-related research centers and clinical centers within academia, and then we sort of all evolved at the same time to self-describe as integrative. The definition was meant to say, well, it's not complementary, it's not alternative. Let's use the best of everything in a model that makes the most sense, using the best evidence that's available. I think there are there's a value to the term integrative. It is probably pretty explicitly academic in the sense that that's where the terminology was adopted and came from. But what I don't like about it is that it doesn't really imply what this is. It's not a term that a consumer would automatically understand with regard to, well, what do I do as a practitioner? I think, for example, functional medicine telegraphs a little bit more in that regard. Oh, I get it. You know, it's about the functioning of the body in a sense. We're not about disease management. We're about improving pathways and systems within the body. And so it's more oriented sort of assessing these fundamental physiologic processes, measuring them in one way or the other, and then intervening in a sense. I think integrative medicine as a construct is much broader than functional medicine. Functional medicine, in some ways, I believe, is kind of a subset, in a sense, of integrative. I also think that functional is very, very focused on biological processes and sort of measurable pathways. There's an allure to that in terms of being able to collect information on a patient's nutritional status and organic acid pathways and fatty acid pathways. But I think sometimes we lose our ability to be a clinician and really look at the patient and understand what are the global patterns that we're seeing just by talking to an individual. I think the integrative model probably redirects a practitioner's attention better in that regard. And so I think there are some real deficiencies in the functional medicine model. And then finally, this term that's been out there quite a while and is very highly consumed within the consumer sector, and that is anti-aging medicine, which has been sort of a lightning rod term as it emerged in the early 2000s and gained quite a lot of popularity among both practitioners and the public, but also suffered, I think, from some negative media attention and some very critical statements coming out of the academic world who weren't so sure what this thing of anti-aging was. They felt like it implied too much of this potential to sort of reverse the aging process and turn back the clock. which people sort of raised their eyebrows at and said, not only is that probably not possible, but it probably also conveys a false idea in the hope of gaining more market share. I think, though, that the promise of anti-aging has been very great. I would also say that my experience has been of all of these different sort of competitive entities, if you want to call them that, between the integrative medicine crowd and the functional crowd. My experience has been the anti-aging has probably been the most progressive in the way that they adopt new information and sort of put pieces together. I've been very impressed by that group, but there are some, issues, I think, with the branding of the label, which is in some ways too bad, quite frankly. Going back even further, where did all of this come from? Again, from a professional perspective, we need to understand what our roots are as practitioners. Why do we care about these things? I think we'd all agree. We want our patients to be healthier. We want them to be well and optimal and vital. But how old is that idea? Did it start back in the 1970s with the term holistic medicine, or in the 80s with complementary and alternative? Interestingly, there's been this ongoing debate and even tension between two fundamental ideas of how to look at the human experience. One lens says we see the person as an ecosystem, one that is vital, is full of energy, is connected to the natural world, and that there's a kind of spirit and soulfulness to who we are as individuals, that we are vitalized by some sort of power or energy, and it gives us our identity. All of the major healing traditions started with this notion that we are, these sort of energetic beings that can be assessed, and that energy can be contacted and improved. And it was very, very focused on sort of what is well and expansive about the individual, whether that's Ayurveda from India or traditional Chinese medicine, or Unani, which is Middle Eastern system, or homeopathy, naturopathy. This core notion of vitalism has existed for several thousand years. Whether a practitioner was reaching for an acupuncture needle or an herb or a manual therapy technique or meditation, all of those techniques were oriented towards understanding the state of the vitality of the individual and correcting and improving it. They did not have a concept of disease, and certainly not disease tied to organ-based or physiologic-based pathology. That was a whole new way of understanding how to look at the individual. That didn't come along until thousands of years later in the 1700s, really 16 and 1700s, with the advent of sort of the scientific method, essentially. And what's interesting about these vitalist ideas is that not only are they sort of tied together in the way that they execute their therapy, so many of them sort of have these core approaches in terms of nutrition and mind-body skills and movement therapies like Tai Chi and Qigong and yoga, purification, which is a core element, not only in these healing traditions, but many religions, which we now sort of relabel detoxification. But from their perspective, one would want to purify not just their body, but their mind and spirit too. The manual techniques such as shiatsu and tuina and Thai massage and Swedish and all of the newer therapies that are now available that are all quite interesting. Certainly herbalism, which is the oldest component of more formal healing traditions, which we draw upon quite a bit in our training. Acupuncture, the notion of putting thin stainless steel needles into the surface of the skin to sort of contact and manipulate that internal energy. And then spirituality, sort of meaning and purpose in one's life and how that drives health and illness. The way that we can understand these vitalist ideas is, through these basic characteristics. They're qualitative, meaning that how we collect information on a patient, if we listen, we touch, we smell, we observe, we palpate, and we begin to build a framework of information based on what's observable. What's interesting about that process then is from the practitioner perspective, they didn't have a CT scanner 2,000 years ago. We didn't have EKG machines or MRIs or PET scans or the ability to run blood work. There was no objective data. It was all qualitative. It was all symptom-based in a sense. So the device tool, the measurement platform that would have to be enacted to understand the information coming out of the individual patient was the practitioner themselves. And so there's always this great emphasis on improving one's skills of observation. And to do that, most of the time, individuals would be expected themselves to meditate, to fast, to change their diet, to move, to breathe, to expand their awareness through these internal exercises and also how they sort of participated in the world. Healers were revered for that they were thought to be sort of evolved beings in a sense. And maybe rightly, maybe wrongly, but there was this great emphasis in that regard that we were the CT scanner. And to be able to be the most sensitive in that regard, one had to spend time developing one's character and self and sort of sensorial mechanisms. So this whole process then, by definition, if you're a researcher, is empirical. It's just how do we collect information through a qualitative model. It's very obviously subjective. It's totally bound within the relationship between the practitioner and the patient. It's sensorial, as I said, because you have to use your 5 senses, probably your 6th sense too in terms of your intuition. It's holistic. We're looking at the whole person, and in particular, we're trying to evaluate for patterns. The oldest healing traditions are all about pattern recognition, trying to identify an emotion that goes with a physical complaint, which goes with a spiritual challenge, and these patterns were sort of codified over time. They didn't distinguish between the mind and the body and the spirit. All of it was sort of a packaged deal in a sense. And so these patterns were sort of collected and refined, and depending on the traditional healing system, certain patterns were thought to be more important than others. And once the pattern was identified, that would then lead to the correct intervention, whether that would be breath work or herbalism or acupuncture or sort of combination of all of the traditional therapies. It's obviously very relational. You have to spend quite a bit of time with your patient to engage in a process like this. Certainly our current medical model is not oriented towards that. And then finally, this perspective is all about health. There was a very practical sense that if you got really sick years ago, there just wasn't a lot available to pull you back from that edge. We didn't have ICUs. We didn't have ambulances. There weren't sort of, trauma bays and surgeons and, all of the mechanisms and tools and techniques that we have today to basically intervene, control physiology, control damage, and intervene strongly. And so the patterns that were picked up in the sense of what am I observing in the individual, they were very interested in when those patterns were emerging in those earliest phases of imbalance. Because as those patterns evolved into more physiologic and more structural changes that became sort of labeled disease in contemporary sense, much harder to fix with these softer therapies. So sort of by practicality, there was always this sense of the best way to ward off illness is just to improve health, to improve the kind of wellness and vitality of the individual. And so this is how these traditional healing systems operated, but it's a very different focus than what we do today in contemporary biomedical medicine. There's value in here. There is thousands of years of refinement and anecdotal success, empirical success, but still success. And I think it's, in some ways, probably the deepest aspect of what draws practitioners into this mode of anti-aging, functional, regenerative, because at the end of the day, when you look at what we do, a lot of it ends up being, for lack of a better term, sort of natural therapies, dietary supplements, herbs, sure, some hormone balancing, but quote-unquote bioidentical hormones, natural hormones. This sense that the body works better, the individual can improve their health more efficiently if we draw upon, in many ways, the power of nature. We might not talk about it in those terms in current circles of functional or integrative or anti-aging per se, but that's exactly what we're doing. We are operating in the mode of a vitalist, in a sense. But the world changed. And the world changed in the 1700s. We had Francis Bacon, and we had Santorio, and a whole host of brilliant men and women who were making scientific breakthroughs. And the notion was, as we discovered blood circulation and were able to measure body temperature, and we developed a scientific method, and immunizations and vaccinations and antibiotics, there was this ever-growing interest in a new way of thinking about the world, not one that was empirical or subjective or relational, but one that was objective, one in which we could measure in great detail what was going on in our physical environment. Still interested in the natural world, but applying a much more acute way of understanding the smaller and smaller aspects of what was not only observable, but the real breakthrough was what isn't observable. So, for example, the microscope. As we're able to peer ever more deeply into cellular and subcellular structures, it was revealing in terms of our ability to understand in ever greater detail what we're actually looking at. So the frame of reference changed, and it changed in a way where we're collecting data that's now measurable and repeatable, and we applied a certain kind of methodology to that, which we call the scientific method, which then gave rise to not only what we could collect in terms of data, but also how well did we understand that data. So the biological sciences and biochemistry and chemistry and physics paired with new technologies that were developing all the time in the 1800s and 1900s began to refine a powerful way of understanding the human experience, one that is much more quantitative in its orientation, objective and objective. Think about how we organize our research processes now. We want them to be objective. We want to control the placebo effect, that subjective, relational, pesky interference that can mess up the results of our studies. Very material in its orientation. What can I actually measure? What unit or subunit or sub-subunit of a particular process or organ system that ends up being something very physical? Maybe not to the naked eye, but we know it's there. And in that sense, it's quite reductive. We didn't care about this relational, almost emotional, psycho-emotional sense of, how do I deal with a patient, but it's very reductive. So now all of a sudden, we're moving away from seeing a person as a whole person, and we're getting better at looking at their parts and dissecting them based on organ systems, for example, which is exactly how biomedicine grew up, and it's how specialties developed. So the cardiologist got the heart, the gastroenterologist got the GI tract, the endocrinologist got the endocrine glands, and so on and so forth. This sort of compartmentalizing of knowledge was very Western in its orientation, and not just relegated to medicine as a social institution. So, for example, this is exactly how our educational system was devised. We would divide the learning experience based on not only age, but also content or category, math, science, social studies. And so lots of kind of constructs within society developed along these lines, and medicine was one of many in that sense. And of course, medicine from a conventional perspective, when I was trained as an MD, is always problem focused. What's the patient's problem list? What's their chief complaint? And then how do we solve each of those problems? We weren't really focused on the functioning of the overall person, how they integrate into their whole life, what's their meaning and purpose in the world, how might that create health or illness within them. But instead it's, how high is your blood pressure, what's your blood sugar, and so on and so forth. So I think, from a practitioner perspective, one who's very, very complete in the way that they interface with their patients, in the way that they talk to their patients, it's really about bridging these two worlds. They both have value. They are both incredibly important in the way that we create our clinical process. And it's not one or the other. I think it's really both. The question is, how do we do that successfully? And it's a different way of thinking. It's almost like speaking two languages in a sense, and I often think about it that way. So these languages that we have to develop and become facile with is a great challenge for people. And oftentimes, even though you have a practitioner who's sort of attracted into the world of functional or integrative or anti-aging, they don't realize that by an instinct almost, we're trying to speak the language of vitalism in a sense. And yet, these are the two competing worldviews that have fought for primacy over many, many, many hundreds of years, and truly fought a legal landscape, a financial landscape, and one or the other sort of has reached primacy. Particularly in the United States, we are absolutely sort of scientific materialism. And there were very specific legal issues that arose in the early 1900s in our country that specifically and essentially outlawed the vitalist therapies. Prior to the early 1900s and 1910, we had a very pluralistic medical landscape. We had an incredible array of healthcare resources in our country: herbalists and naturopaths and homeopaths and healing spas and detox centers and nutritionists, as well as conventional physicians. Interestingly, they called themselves the regulars, and they then labeled everybody else the irregulars. This was in 1840s, long before the term alternative came about. And so this notion that I'm going to call myself the center of the medical universe, I am the regular, and so by definition, everybody else is irregular. It's the same for the term alternative. This notion that it's everything else that's not taught in medical school. Well, it turns out that the reason why the landscape changed, where we just didn't have access to these kinds of ideas and practitioners, was because after 1910 in the Flexner Report, it basically led to the establishment of about 130 federal and state laws that basically eliminated from the marketplace all other forms of competitive therapies. There is no such legal device in just about any other country in the world. It's why we're so divided. These notions of vitalism were then driven underground for years and years and years, basically lost from the healthcare landscape and done very quietly in the backyards of people where they were growing herbs, and you'd have local indigenous healers or community leaders that were trying to preserve traditional healing knowledge, but it was not part of the conventional vernacular. And it wasn't until the 1960s, in fact, with certain social movements, particularly the reaction to the Vietnam War and the women's movement, and even what was termed the holistic health movement, where, for example, women were becoming ever more frustrated with the way they were being treated within the medical system. And there was this quote-unquote return to nature, return to natural childbirth, return to Mother Earth, in a sense. And there was a revitalization, a rediscovery of these older, quieter healing traditions that still existed, but well below the radar screen. And in fact, probably and primarily it was women who saved us in that sense in this country, that they often were the ones who preserved traditional healing knowledge and harbored this notion that vitalism matters, that wellness and optimal health and healing had to be part of the human experience, that we couldn't just be problem-focused, that we need to be more relational and connected, that there are some things that you just can't measure with a tool, but that you can sense. And so it wasn't until the 1990s where there was certain research conducted to show that, in fact, up to 50% of the U.S. population were using these sorts of therapies. But 70% of those consumers were not telling their physician. 70%. And so if almost half of the U.S. population were accessing these older therapies but basically not telling anybody, this sent shockwaves through the medical community. It's what instigated Congress and therefore NIH to start funding research in quote-unquote complementary and alternative medicine. And originally, again, it ran under the label of alternative in that regard. It was thought to be very alternative, below the radar screen, done quietly, outside of the purview of the medical community, and people were still using it anyway. And so research centers like mine at Michigan and a few others were funded to begin to better understand what was it people were doing. So the labels began to change as the public began to understand and come out of the closet with regard to utilizing these therapies. And so we went from complementary and alternative, and then in the early 2000s we see the formulation of functional and integrative and anti-aging. These groups sort of competing for market share in a sense, but still very focused on this notion of vitalism. No one talked about it in those terms, but this is the medical anthropological view of actually what we're doing. The reason why I think this is important is because this is the fundamental drive of the consumer with regard to why are they interested in these therapies in the first place. So we have, the CAM community, if you want to just measure it, is at least $30 billion a year. The anti-aging expands to $45 billion. And then if you want to include sort of all wellness and sustainable living and personal products and services, this is a $1 trillion industry. When you look at the next 5 to 10 years, we will have, if you compare the amount of individuals who are consuming wellness-based healthcare versus the amount of practitioners who are trained, it's been estimated we'll have a deficit of up to 4 million practitioners to service the need of these individuals across the U.S. population. 4 million. So the role of education is great and very, very required, and we have a public that has never let go of these older ideas. And in fact, we've sort of emerged from the shadows in a sense, because you can't walk into a supermarket without seeing some sort of magazine that says anti-aging or natural or holistic, or it's a yoga journal, or it's about, the greatest new herbal breakthrough. These ideas go back 1,000 years, but it's driving a huge consumer movement, and one that I think is really, really important because it's reshaping the healthcare landscape. I would say after the Flexner Report in the early 1900s, we were very problem-focused, scientific materialism-based, and we're all about sort of disease management. Let's measure sickness and intervene using drugs and surgery. That was sort of, in my sense, that was 20th century medicine. My hope, 21st century medicine, will be a much greater integration of these vitalist notions within academic circles as well as in other healthcare enterprises. And that is to say, we are all about proactive, preventive, personalized healthcare, one that embraces these older ideas of vitalism, but we're getting ever better at measuring greater and greater details of the individual down to the genomic and metabolomic level, especially with the role of technology and the way that we collect information, but also the mathematical modeling to understand these big data sets. There is lots of talk about the quantitative self, that maybe we'll collect 1,000 to 2,000 analytes on individual patients every year and track their changes over time and try and capture those early disturbances long before they ever arise into a physical illness. This is absolutely a vitalist notion, but it's being driven by high-level technology and mathematics and sort of the new thinking in medicine, which is the metabolomics and genomics. Interestingly, that's exactly what's going on in the room next door to the module that's coming up at the end of April. So this is the business and legal side, and then there's going to be the metabolomics side, and we're bringing in literally world experts to teach the metabolomics weekend. It's very, very exciting. So what are the trends then? I mean, it's really being driven by the consumer. So consumers are changing how medicine is delivered, but we also see ever greater competition from all sorts of practitioners who don't need to go to medical school, but are adopting these ideas and many of the approaches and strategies. In the marketplace, we're seeing very interesting collaborations as a result around these notions of sort of wellness and health. So partnerships between medical, wellness, and hospitality industries, and then finally, rapidly changing marketplace. And it's shifting dramatically. We're seeing ever more large businesses enter our space, scooping up and buying smaller businesses, consolidating these resources, and delivering them sort of to the masses. It's amazing to watch what's happened over the past 5 years or so. There are also, as a result, many, many regulatory and legal issues. All you need to do is talk to your local compounding pharmacist. They will tell you how much things have changed and are continuing to change, and unfortunately making life difficult for a lot of people. So what does this mean for the practitioner? Well, it has everything to do with what is your brand, what are the services you offer, and how do you organize those clinical services? What's your business structure in a sense? There's basically two approaches to that idea. One is what I call the roaming model, and that is to say a practitioner who is not tied to a physical infrastructure and is able to move from place to place or even practice virtually and with low overhead. And then the other is the traditional bricks and mortar that we're all used to. And then there are these sort of other combinations that we're seeing, the anti-aging clinic with alternative providers, and anti-aging spas with anti-aging with aesthetics. We see hospital-based wellness centers that have been popping up to try and grab market share. There are now branded hotels with medical services where you can go and stay and get an executive workup. And then finally, sort of that traditional destination resort with wellness programming, sort of a la Canyon Ranch, for example. There's all sorts of combinations that are being offered out there. And it's interesting to watch how these things are evolving. From the professional perspective, I think there are sort of a variety of factors that are driving the success of the physician-patient relationship in that regard. The therapeutic relationship really has become sort of a foil, in a sense, for the historical, sociopolitical, financial, and cultural forces that are shaping the evolution of contemporary medicine. And that is to say, you will have these discussions with your patients. They will talk about their frustration with insurance. They'll talk about their experiences within the conventional medical system. They'll go into great detail about why they're choosing you as a practitioner instead. And it gets into sort of all of these non-clinical issues that I think are really important. And we as professionals need to have and understand sort of a ready set of information to be able to create a discussion with patients that is solid and reflects a deep knowledge of our own field. So there are patient expectations, which I think are very high. Now that we've retermed it, it is vitalism. It's those vitalist notions. That's why they're there. They want to get better. They want to heal. They have an instinct for that. But they also expect that you're going to be really good as a conventional clinician too. So I've seen the opposite, people who sort of put themselves out there as a healer, but they're not really acutely tuned to biomedical issues, and so they end up missing things in their clinical practice. We still have to remember that we are full and complete practitioners, and that means drawing upon the power of conventional medicine as well as these older vitalist notions. And then also respecting the fact that this is very much consumer-driven. Many of us would not be here if it wasn't the public out on the leading edge saying, I want this. The physician role or practitioner role, I think, in and of itself is changing because of this patient expectation to embrace both of these worlds. And the most important and challenging aspects of clinical and business success are to combine all of these into a single framework. So what is the physician role then in the context of all of this? It's that from a healthcare perspective, you are a wellness and lifestyle expert, quote unquote vitalist, but also an expert in conventional biomedicine. That is no small task. When I lecture on clinical topics, especially for the newbies, I can see their eyes get like saucers because it's so much information for them. And they're trying to think differently about understanding what's going on with their patients. It's a whole new language. It's a whole new approach, a new way of measuring things and understanding. And it leads to an entire new set of therapies, which can be overwhelming. It's like going back to medical school all over again. And I think sometimes people don't realize the complexity of what we do. This is not for the faint of heart in that regard. But there's even more than that. It's not just about being a good clinician. We are cultural leaders. We are the shamans of this new medicine, in a sense. We have been anointed by the public to create change. We have a responsibility to be an advocate and a voice for improving healthcare. We sit in our respective individual clinics and hand out the herbs and hormones and hope for the best. That all of this is happening in a context, and we have to step forward in that regard because, especially for the MDs in the crowd, rightly or wrongly, we still are considered sort of the leaders in a sense. And when we make change, the rest of the healthcare system will change too. So we have to advocate for our patients. We have to see it from a social change perspective. And then finally, again, to be the complete practitioner, it's about how do you run your business too, because this is all fine and good. You can advocate for these ideas. You can be an excellent clinician. But if you can't keep your doors open, who cares? And so this whole weekend is really about this last piece, and that is to say, who am I as an entrepreneur and how service-focused am I? So the 5 keys to clinical success, patient relationships, clinical outcomes, reputation, meaning how good am I at getting people better. I get asked all the time, how do you market? How do you stay so busy? Why is your wait list 5, 6 months? And I'd say, you know what? You just get people better. You treat them well, but you get them better. And then word spreads. There's no amount of marketing, there's no amount of advertising that can pay for the kind of word-of-mouth experience that starts to accumulate throughout your community if you're someone who's an excellent clinician. That is first and foremost. So it's your reputation that really matters that results from your clinical outcomes. And then the 5 keys to business success overlap, but it really kind of changes its focus, and that is to say, yes, your reputation, but what is your business acumen and how good are your strategic relationships within your practices and also within your community. So business acumen is where we're going to focus for the weekend, and that is to say, how do I make decisions as a business owner or participant in the clinical process. So you fundamentally have to start with this notion that we are not often in the insurance pool, and so we are fundamentally consumer-driven. We're service-oriented. That raises the stakes in terms of patient expectation because when they put cash on the barrel ahead, they expect a certain experience. As a result, because we've shifted away from the insurance-based pool and into oftentimes cash-based practices, it means then that our failure rate, the functional medicine and anti-aging clinic failure rate, is basically approaching the small business failure rate. And that has meaning. You know, that's a pretty high rate. This is risky in that sense. You have to be good at what you do and get a really great education. We know it's a good idea, but it's, you know, the failure is sort of in the bad execution side. And then success is determined by the patient experience, as I say. So what is business acumen? What's the definition? It's keenness and quickness and understanding and dealing with business situations. It's good business sense and sound business judgment. It's business savvy. But even more than that, it's a disciplined approach to the business process. And that is to say, how do I think about the different aspects of my corporate process? So business acumen we divide into 3 categories. It's leadership skills, business skills, and management processes. So for leadership skills, it's that visioning, direction, outwardly focused. How do I bring in the right group of people and execute my vision and mission in a successful way? For business skills, it's my industry knowledge, it's my competitive mindset, it's a winning strategy, it's my resource understanding and risk assessment. It's this notion of how savvy am I in the marketplace, and do I understand my competitors, and do I have a will to win, essentially. And then finally, from a management processes perspective, it's the strategic planning, your SWOT analysis, for example. How do I run a break-even on a particular device or set of services? How do I do financial forecasting? How do I look at my P&L statement and understand, do I have the right amount of staff for my total revenue? Am I overstaffed or understaffed, for that matter? There are ratios for this that we're going to teach. How do I better manage customers? What are my operating processes, which we'll get into? And then also regulatory compliance issues. So we have a whole day bringing in a number of legal experts who've been there, done that. I mean, they are the ones who have defended physicians who've been called to the carpet about, sort of our style of practice, often by state medical boards. So we need to be really aware of what are the legal and ethical issues, as well as the business and strategic issues that go into running a successful practice. So once again, we're going to encourage you to bring in your financial statements, your marketing material, any legal questions that you might have. How do I transition from insurance to cash? How do I spread the word in my community about what I'm doing? How do I develop a brand for myself that distinguishes me from other local competitors? All of this will be going into the weekend, and I think it's going to be one that will be very, very exciting and incredibly progressive from that perspective. I don't think I've seen a weekend that looks like this because we're bringing in some really wonderful speakers in that regard. We've been quite careful in terms of, what do we want to teach and who do we want to teach. This